it is really critical to screen everyone for postpartum mood disorders so as to prevent worsening symptoms. So what are postpartum mood disorders themselves? So I mentioned baby blues. That's a very common experience right after birth that seems to be associated with that initial hormone dip, right? And it can certainly feel like sadness and sleep disturbance, irritability, anxiety, tearfulness. That the baby blues seems to peak sometime within the first week after birth and lasts for maybe another couple of weeks. And the majority of parents, birthing parents, do experience some version of that often resolves on its own if the family has enough social support. Then there's postpartum depression, okay? And we might say that maybe 10, 15% of postpartum people go on to develop a full-blown postpartum depression, but that's likely an underestimate because a lot of the studies have only looked at the first few weeks postpartum, and sometimes the postpartum mood disorder does emerge much later, right? Sleep troubles, right? You've gotten the baby back to sleep, but you yourself cannot fall back to sleep. Depressed mood, sadness, a loss of interest in activities, especially activities that used to be enjoyable, weight loss or weight gain, restlessness, or the opposite, slowing down of movements, right? Fatigue, fogginess, feelings of worthlessness or guilt. All of that deserves immediate professional care and sometimes medication, and we're going to get to that as well. But there are other postpartum mood disorders as well, postpartum anxiety. So most people who experience postpartum depression also experience clinical levels of anxiety. Every new parent, of course, is worried about the fetus during pregnancy, is worried about the newborn baby. But postpartum anxiety disorder is much more amplified than that. It occurs when those worries become excessive. They become uncontrollable. I can't put it out of my mind. I'm worried that the baby's not going to gain weight, or that the baby's never going to sleep, or. We say that it's a postpartum anxiety disorder when the worries, the excessive anxiety is really interfering with daily life, interfering with taking care of the baby. The worries might be about the health of the baby, might be the parents' worries about their own health or the health of their partner, worry that their partner might die, or that they themselves might die and leave the baby without a parent, right? Really intrusive worrying, which can include panic. If social anxiety is involved in the postpartum anxiety disorder, that might actually also include some pretty extreme fears that someone might have, that they're going to be socially judged. Judged for their parenting, judged for not feeling happier about being a parent. And then that social anxiety can lead to even more isolation, because it may feel really hard to go and interact with people and might lead to avoiding interaction. As an extreme variation of this, postpartum PTSD, post-traumatic stress disorder, can occur after traumatic deliveries. I work with many parents whose infants have had extreme medical conditions and interventions, right, with often extraordinarily high risks to the child's health, right, that can feel extremely traumatizing to the parent. Okay, so two other variations of postpartum mood disorder. Postpartum OCD. What does that mean? So Postpartum obsessive compulsive experiences, repetitive thoughts, intrusive thoughts, mental images, visual images that feel at the very least inappropriate, unwanted. Oh, I don't want to think about that. Sometimes even gruesome. And those repetitive thoughts or images might cause stress. Impulses, right? This is the compulsion piece of OCD. Impulses to do actions that might feel like they provide, oh, if I do this, it feels like it relieves some of the obsessive thoughts or images. So maybe there's some temporary relief, but ultimately it doesn't actually help the obsessive thoughts go away altogether. So about 9% of people who experience postpartum OCD, about 9% of postpartum parents experience some version of postpartum OCD. Of those folks, at least half also have postpartum depression. So we're talking about these different categories of postpartum mood disorders, but there are overlap, right? Like I said before about postpartum anxiety, most people with postpartum depression also have postpartum anxiety. The most severe postpartum mood disorder is postpartum psychosis. And this is often the postpartum mood disorder that ends up in the headlines of a newspaper because some tragedy has occurred. It's the most severe expression of a postpartum mood disorder because both suicide and infanticide are risks of the disease. Symptoms of postpartum psychosis usually show up. It could start within a few days to a few weeks after birth. And often how it first shows up is that the other people in the life of the birthing parent notice that it's really hard to communicate with the parent. The parent might seem like they're out of touch with reality, having extremely rapid mood swings, might even be hallucinating. Visual images, that's different than a thought, right? Like literally a hallucination, seeing things that are not there. Or auditory hallucinations, right? Voices that someone might experience as telling them what they should do. And that's when the parent and the child are most at risk for harm.